let's start with a little bit of grounding on what's current state of health impact. And I'll tell you that as I've looked through the organization, our results are very impressive. Again, I've been in healthcare for over 30 years. I think sometimes we get lost on the terms and words, but I've not seen these things in my career, and we'll talk about a few of them. So, using our expert opinion service, 78% of patients have improved treatment plans. Now, what does that mean? First of all, having been in healthcare, whenever someone calls me with a question, right, you're always somebody's friend with a phone number that has a medical issue. My first thought is always, do we have time? If you don't have time, that's where problems sometimes happen in healthcare. If you have time, typically you get to the right answer. And if you have time, you get a second opinion. So what do most people do? Right? Call a friend, look at Google, who do you recommend? But what we've done is create a process and methodology that removes any conflict of interest by getting your information to an expert in the field. We've already curated that for you, getting all of your data. 78% of the time, we're improving patients' care, right? The national average here is about 20 to 40%. These results are spectacular. 29 days to cancer treatment, early treatment. Every single study in the area shows early cancer treatment detection reduces toxicity, improves mortality, improves patient outcomes. Plus, can you imagine just getting your diagnosis a little bit earlier? It's a great user experience. 48% reduction in readmissions when you enroll in our transitions of care and readmissions program. National average here, about 20%. If you do paramedicine, which is ambulances that come to the house, or a case management program, both of which have their own challenges. We do this at scale. This is where you get your ER readmissions, your hospital readmissions reductions. Again, very, very strong results. Complication rate in our surgery care is less than 1%. Again, I'm going to give you some benchmarks. National average is 1 to 5% for low acuity surgery. Our surgeries are typically in that mid-tier, 5 to 10%. Again, we're at best practice levels here. Primary care is tough, right? The number one factor for challenges in our health system is the lack of access to primary care. It's proven a million times. If you are an established patient in a primary care practice, typically it's somewhere between 7 to 14 days to get in. If you're a new patient, it's 20 to 30 days. We are seeing patients the same day because virtual scales. Right? And then the last one is our NPS score. Your typical health system is somewhere between 20 and 40 on their NPS. 90 is clearly best practice across the country. And not only that, we did 2 million ambulatory care encounters last year. For a frame of reference, that's as large as some of the largest health systems.